All right, Dr. Bree, you have a 30-year-old man presenting with 3 days of fever, abdominal pain, and diarrhea. What are you concerned about?
Okay, diarrhea is fine, because, like, everyone kind of gets diarrhea. Like, did he drink, like, milk? Who gives a you know? Maybe he has, like, the period poops, and, like, he's just on his period.
Okay.
And, like, fever, maybe he just, like, was warm, and, like, he was in a blankie for too long. And then abdominal pain, like, I get abdominal pain, like, all the time. So, like, who gives a really? I think the main issue that we need to consider is that it's a 30-year-old man, and that means that he's, like, already doomed and, like, close to death. What's a diagnosis for, like, start making your affairs in order?
Like end-stage cancer starting on hospice?
Yeah. Can I just type in hospice?
I don't think that's a diagnosis.
Oh, wait. Wait, it came up. Oh my God.
Why would it be antiphospholipid syndrome?
Because I know that one. I recognize the name. I know that one.
Okay, wait. Explain to the class what you think antiphospholipid syndrome is.
Okay, it's where your blood is too thick, so you have to move around a lot because otherwise you get blood clots really easily, and that's really bad. And so if you have it, you need to take baby aspirin.
Basically, it is it's commonly associated with lupus and other autoimmune disorders, but
It is?
Yeah, no, that's why I thought you said it, because it was like a lupus joke.
Oh no, I just might have it.
Oh. Okay. All right. Well, yeah. So antiphospholipid syndrome, what they're talking about is you have antibodies that are not against like viruses or bacteria, but they're against your own cells, specifically the anti-cardiolipin antibody or the anti-glycoprotein antibodies react against your platelets, and they activate these platelet endothelial complexes, and that makes a lot of blood clots in places where it shouldn't be. And the problem with that is that you form blood clots, and young women who are of childbearing age will also have recurrent miscarriages. So, in anybody who has, maybe, I would say probably two or three recurrent abortions before 10 weeks of gestational age, you actually do need to do this anti-cardiolipin workup, because that is a, genetic problem that you're going to be able to suss out through their recurrent abortions. And you'll also be able to prevent them from having blood clots in the future by giving them blood thinners.
Are you done talking? I tuned out.
Yeah, I'm done talking. Do you want to diagnose this 30-year-old man?
Yeah, they have antiphospholipid syndrome.
Okay.
He reports back that the symptoms started the day after attending a backyard barbecue. Ooh, he has foot and mouth disease.
Okay, foot and mouth disease.
Isn't that the one with the cows? What's the one that British people had with the cows?
So there's mad cow disease, which is a prion disease, which is scary. Mad cow disease. Oh, yeah! Do you think that's right? For mad cow disease.
Because there's a barbecue. You eat... Oh, sorry, you have to explain. Okay.
All right. So mad cow disease is a prion disease. All right. This is characterized by misfolded proteins. And proteins are scary because your proteins fold in a certain way to work. And if they're not folded correctly, they will start to basically corrupt other proteins and cause them to fold incorrectly as well. And then these non-functioning proteins will basically start globbing up and tangling together. And that leads to severe neurodegeneration. They'll start having deposits in your brain or other organs. And mad cow disease, things like Creutzfeldt-Jakob disease, they're very scary because, these misfolded proteins can exist on surfaces, surgical tools, hospitals, and it can start infecting and basically just spreading very quickly. So yes, you can get mad cow disease by consuming the misfolded protein of a cow, although you wouldn't necessarily be concerned with 3 days of fever, abdominal pain, and diarrhea. You'd probably be like coma.
Well, there's a backyard barbecue. and then he gets mad cow disease. I think that that's fine. He reports the diarrhea was initially watery. That's disgusting. But today, several episodes became blood tinged. I feel like that's maybe he just needs like to flex less or like wipe less hard.
Like you're worried about hemorrhoids?
Yeah.
So you think he just had food poisoning from the barbecue that caused him to get the diarrhea?
Yeah.
And then he separately
he
had
like,
an external
he was
hemorrhoid.
Like wiping too hard and like cut himself or something because of the diarrhea, because he was like grossed out by it, and he was like, I gotta wipe with this like rough cardboard, you know?
Okay.
What's the doctor term for food poisoning? Oh, I got that!
Gastroenteritis. Wait, they have ARFID?
Yo! This man's got ARFID, I've decided.
Why are you looking? Why did you click it? You already gave me an entire explanation.
I got ARFID. It was like a Brie mention, and I felt seen by the website.
Do you want to educate? Do you want to do the talking?
Hi, chat. I'm very bad with eating foods, and for me specifically, ARFID makes it so I'm very bad at eating foods that I've never had before, and it makes me really uncomfortable. It's not that I have like an allergy to them or anything like that. It's just that I'm like, there is like a brick wall in front of my mouth the minute I go to eat a food that I've never had before.
So ARFID is avoidant / restrictive food intake disorder.
Just reading from the website.
No, this is what I already know about ARFID. All right, so it is not necessarily an eating disorder like anorexia or bulimia, but it was kind of just like what Brie explained. It's not that you have a negative association with your body image or some sort of, you know, psychological dysfunction with eating. It's just that sometimes you see a food and you just hit a wall and you just suddenly do not have an interest in eating it.
He recalls eating a new low-temperature smoked chicken recipe in which the meat near the bone appeared undercooked. This man, can I diagnose him with being a patient?
I guess.
Because he comes in and he goes, hey, I have 3 days of fever, abdominal pain, and diarrhea. And the first thing after that out of his mouth is not, oh, I ate a new type of chicken that looked undercooked. That should have been the first thing that I ate raw chicken. It might be salmonella. There you go.
Okay.
How do I spell salmonella?
Salmonella is a good, yeah, it's a good diagnosis.
With typhoid. Why does it have typhoid next to it?
There's Salmonella enteritis and Salmonella typhus.
Oh wait, enteritis? I recognize that from House. What's that mean?
Enteritis just means like inflammation of the digestive tract or like the small intestine. So gastroenteritis means inflammation of the stomach with the small intestine. Gastritis is inflammation of the stomach. So it's just describing where the inflammation's actually happening.
Why is there only one?
Doctordle is weird and only has like a few select diagnoses. It's not like it has like every single diagnosis under the sun.
But it got ARFID! Oh, there's hand, foot, and mouth disease!
You were already, you know, on a closer diagnosis pathway. In terms of Doctordle, you know, this guy mentioning that he had chicken like in the fourth statement, like if this was a normal board question or like a normal like patient interview, you would get everything at once, obviously. But in terms of Doctordle, they only give you one statement at a time because it's like Wordle, right? You're not supposed to get it in like the first yes.
Can you put this next one into terms that I understand? Because I don't know what any of this is.
Okay, so this is just talking about the culture results. So this says stool culture demonstrates oxidase positive, curved gram-negative rods that grow best at 42 degrees Celsius under micro-aerophilic conditions. Okay, this is basically just dog whistling every first-year med student because in microbio, you actually learn like the random facts about bacteria at this level that you'd never utilize in your clinical practice at all, unless you actually become like a pathologist or something. If you were a first year med student, you would probably know all these useless facts about different bacteria. But this one's probably going to be Campylobacter C. jejuni. I think C. jejuni might actually be the most common cause of bacterial diarrhea. I think a lot of people default to Salmonella or E. coli, but C. jejuni is probably going to be my guess. I think E. coli would probably present more with a bloody diarrhea. And I think Salmonella would have a longer incubation period before experiencing symptoms. And they wouldn't be, you know, this bloody this quickly. Also, they would probably give you some other thing where like bacteria is plated on hecaton agar and turns black or something. I don't know. That's like another random fact that you learn about bacteria in med school.
Okay, so how do you spell the thing that you just said?
Campylobacter. Camp. Please tell me it's right because I don't really want it.
Boo!
Right.
Boo!
Yay! We did it!
Boo!
We did it!
He was treated with supportive care and oral rehydration. Oh, I'm sorry, so he was just, what does supportive care mean?
Supportive care usually just means like fluids, electrolytes, right? Because treating or like trying to kill the bacteria itself doesn't really do much. Patients improve more with repleting the losses from the severe diarrhea that they had.
A 19-year-old female, abdominal pain and dissension, urinary frequency and constipation. Ooh, okay, well, ignoring the constipation one, I get this when I drink water.
You can't just ignore symptoms in the presentation. All right, so she's got abdominal pain, right? Her belly is bloated, distended, it's, you know, bulging out. She's peeing a lot and she's constipated. So when you're thinking about, you know, symptoms, think about how you can localize them physically, right? So, you know, urine, GI, and like skin, really. These aren't necessarily related by one organ system, but physically they all are happening in the same place, right?
I like ovarian theca cyst because the theca sounds like something from Warrior Cats. We're doing that one.
It's pronounced Theka.
Pelvic exam reveals a painful right adnexal. What's an adnexal?
Adnexal means that it's next to the ovary. Actually, wait, you were pretty close. Wait, so it could be an ovarian. It could be an ovarian tumor, actually. there are a lot, or like an ovarian cyst. Like it could be a lot of different things.
I like this one because the word fistula sounds really pretty.
Vesicovaginal fistula? Okay, so
I think fistula sounds like the name that I would give a child.
Do not name your child fistula. All right, so a fistula is a connection between two things that's abnormally there and, you know, doesn't normally exist. So a vesicovaginal fistula is talking about a connection between the vesicle, which is the bladder, and the vagina, right? And a common symptom of a vesicovaginal fistula is going to be that you're going to be urinating out of the vaginal opening.
What's HCG?
Beta HCG is human choriogonadotropin. This is a chemical that's secreted by the placenta when it forms, and it's going to be what's detected on a urine pregnancy test. I think...
What's LIDA?
LIDA? Oh, lactate dehydrogenase.
So like milk?
No, so it's specifically lactic acid, which is what it's concerned about. But a mild elevation in LDH is usually something that you'd see in like cell death or specific types of tumors that are causing a lot of high turnover of cells. It's a pretty non-specific finding. I mean, you could find a mild elevation in LDH in a lot of things. It's not like a super red flag screaming symptom. I mean, obviously it's a tumor. Like I think it's going to be a cancer. It's either a tumor or a cyst that's pressing against the adnexa. It's causing all of her symptoms. It's just you need a lot of lab work to figure out, you know, where we're going.
Sex cord theocoma.
What?
I don't know. I have a toothbrush on my desk that's Colgate, so I typed in Col, and it came up with sex cord theocoma, and sex cord is near the ovaries.
Okay.
What's serum AFP?
Serum AFP is serum alpha fetoprotein, and it's a specific type of marker that's given off in specific types of cancer.
Okay, so she has cancer. Wait, can it wait, someone said it in chat. Can it be the yolk sac tumor?
Oh yeah, probably. And then
Whoa,
adnexal.
Subnautica!
Wait, you got it.
What?
Wait, you got it. All right, everybody, say goodbye to Bree.
Goodbye.
Thanks for stopping by.
See you later. Goodbye.
Goodbye, Bree.
Bro, who the was that dude? Weirdo.
Hello and welcome to the Doctordle stream.
Hello. I am definitely a hypochondriac, so I try not to Google my symptoms because I know if I see something on WebMD, I'm gonna think that I'm dying. My medical knowledge is subpar, but I think it's getting a little bit better. I feel like I go to the doctor relatively often. There are some things that I have to schedule that I hold off on, but general checkups, I think I'm pretty good.
That's good.
Yeah.
That's better than a lot of people.
A 57-year-old woman presents with abdominal uterine bleeding for 3 weeks. Oh, sorry, abnormal uterine bleeding.
Imagine, like a family member, like your mom, your aunt, whatever, calls you, right? And they've just been saying that they've been having uterine bleeding. They've noticed blood coming out of there for 3 weeks, way after menopause, but they don't know what's going on. It's probably, I don't know if it's painful or not, but they're giving you these symptoms. Where would you start with, right? Like you tell them, yeah, go see a doctor. Oh, they can't get an appointment for like a week. So how would we want to approach this diagnostically? Like using the internet, what kinds of things would you start like Googling up?
I guess I could Google what could cause abnormal uterine bleeding in a woman after menopause.
Yeah, do it.
Okay, let me Google possible causes of abnormal uterine bleeding in after menopause.
All right, so we looked up possible causes of abnormal uterine bleeding. We get the AI Google thing that's trying to take over like etymologies and stuff.
Postmenopausal bleeding, bleeding from your vagina after menopause isn't normal. Non-cancerous conditions. Oh, uterine cancer. Oh God. Vaginal atrophy.
So we have a good starting place here, right? So we're on Cleveland Clinic, right? Cleveland Clinic is a reputable source. It's a reputable healthcare system. Now we have, abnormal uterine bleeding in a 57-year-old woman. For Doctordle's case, I mean, it can be any of these things, right? It could be vaginal atrophy, it could be polyps, it could be hyperplasia, it could be cancer, and all these things. So, I mean, just throw one at the wall and see what sticks, because you're only getting this one sentence so far.
Well, okay, I don't think it'd be hormone replacement therapy.
Unless, like, the fourth clue they give you is, like, she was recently started a hormone replacement therapy.
Okay, well, yeah. I guess maybe towards endometriosis type of things, maybe endometrial hyperplasia.
Yeah, that's a good one too.
Oh wait, I have to type it in.
Yeah,
I forgot.
Oh. Oh.
Let's go.
Wait, you got it in one? Wait, I'm actually impressed.
Thank you.
Yeah. So abnormal uterine bleeding, you're worried about, like, one, a problem with the uterus, or two, a problem with the hormonal axis that's leading to that, right? A lot of women, postmenopausal women, get confused when it first happens, and they're like, oh, my period came back, which, is not necessarily a good thing if you are postmenopausal.
Yeah.
And you're lacking the normal LSH, FH feedback axis that happens when you're a lot younger and having monthly cycles. So she has no significant past medical history and she's never been pregnant. The ultrasound does show that she has a thickened endometrium. So the lining in the uterus that's there to shed every month.
Yeah. It's too thick.
Yeah, or sustain a pregnancy in the case of a pregnancy. Even though it's supposed to shed every month, now it's extremely thick. And because of that, it's vascularized, it's full of blood vessels, it's full of...
And that's why it's shedding on its own, even though she doesn't have periods anymore.
So obviously this part isn't supposed to happen, but in things where endometrial hyperplasia could be, conflated with other conditions, or you would see in a younger woman, right? Because they are going to be bleeding monthly as well. So are you bleeding in between when your normal period is? Are you having extremely heavy and painful periods, or heavy flow days, like a lot more than normal, like 5 heavy bleeding days in a row, and these sorts of things?
Yeah.
So Yeah, she's also receiving estrogen replacement therapy, so it could also have been the hormone therapy, and we could also talk about breakthrough bleeding as well. But you got pretty lucky. You solved it in
That's
one.
all skill, bro.
The patient is like, "Thank you, Dr. Hazmi. You're doing amazing work out here," and leaves you a 5-star review on Google.
Thank you, random citizen.
Worsening fatigue, excessive sweating. I would say this could be a adrenal problem, maybe like hypercortisolism. He's 40. Yeah, sure. Let's say hypo. Let's say it's Addison's disease.
Do you want me to type that?
No, that's just what I'm saying. You go for it.
Guess I would say causes of excessive sweating and worsening fatigue.
That's why I was kind of thinking on a different
hyperhidrosis. I don't think that's I don't think they have the right one. Okay. Symptoms of hypothyroidism in men. Severe fatigue. Okay. Ooh, erectile dysfunction. Fun. Should I guess that?
Sure. I mean, if you think worsening fatigue and excessive sweating lines up with what you looked up, you only have one sentence so far, right? So
yeah,
you don't have too much to go off of.
Okay, I might have to ask you, what is the difference between these?
One is like replacement of iodine. It causes a paradoxical decrease in thyroid function. The other one is congenital hypothyroidism, which we used to call cretinism. But this is what you see in countries where people don't have enough iodine intake, and they have hypothyroidism because of a nutritional deficiency. This is why in the United States, if you notice, all of our salt is iodized because people eat salt a lot in their cooking, and the American government decided to start putting iodine in salt so that we wouldn't have iodine deficiencies. But he's 40 years old. Maybe he stopped eating salt. This is something that you see in a lot of patients, in the 21st century too. Like when pink Himalayan salt was becoming a thing, or people are trying to eat fancy sea salts or whatever, they're not eating just the generic Morton's iodized table salt, and they actually develop iodine deficiencies because they're trying to eat fancier salts or salts that are better for you, but they actually end up developing a very basic deficiency that the government tried to correct in the 50s.
Wait, so then there's iodine excess and iodine deficiency. What if he eats too much salt?
Well, then you have a problem with salt intake probably before you deal with an iodine intake problem.
I'm going to say you have congenital hypothyroidism. No. He was recently... Oh, wait. Oh, interesting. He was recently diagnosed with diabetes mellitus after an elevated hemoglobin A1C was noted.
Okay, so we're thinking diabetes.
Diagnosed in hydrosis cause fatigue. Okay, I'm doing it. it.
Okay.
Central nervous dysfunction of sweat secretion. Blah 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 blah. Blah. Diabetic, autonomic. I don't even think that's here. Okay, maybe something with his hemoglobin instead. An elevated hemoglobin cause fatigue.
So a hemoglobin and a hemoglobin A1C are two different things.
Oh.
So you want to make sure that the search engine knows that, or knows what you're trying to ask for. I played Doctordle 3 times on stream now, and I have never gotten lupus as an answer.
Is it this?
Systemic lupus erythematosus is the full name for lupus, yes. I do not think this is lupus.
Damn it, dude, that would be so funny. It still says diabetic neuropathy, because that was the one that it said. This one says peripheral artery disease. Peripheral artery disease.
Peripheral artery disease is just when you get cholesterol and fats clogging up your arteries.
Osteoarthritis. I don't think that would be it, would it? Because does that have to do with swollen feet?
I mean, it explains the joint pain, but
not the
does
swelling.
not explain the diabetes, the sweating, the fatigue.
Dude, everything says this. Everything says diabetic neuropathy, but it's not even an answer, is it? Dude, now low-key, now it might be diabetic foot ulcer at this point.
Yeah, and then the 6th one is going to be patient complains of a gigantic ulcer on the bottom of his foot.
Okay, acromegaly, diabetic patient with sweating, fatigue, joint pain, foot swelling. Yeah, but it just says diabetes. Wait. Dude, I'm just gonna say acromegaly.
Nice.
Oh, let's go! Oh
Yeah,
my
so
god.
somebody said it in chat from like the first one, and I was like, what the f? But I was getting towards it on the second one. The picture was painted a little weird, but they did introduce the diabetes as a way to link all of the 3 symptoms in the first place.
I was so confused.
So acromegaly is a condition where your body secretes a lot of growth hormone, but you're already a grown man at 40, right? You're not playing League of Legends anymore. You're not
Okay.
you're unk. Okay, so when this happens, your body is basically already done growing. Like you're not going to get any taller, you're not going to get any bigger. But because of all of this growth hormone is being secreted by the pituitary, you're basically growing inside of your skeleton, which is already fixed. So that's why they have joint pains. That's why they feel like their shoes don't fit. That's why they feel like their hats don't fit. Coarse brow and these features. If you look up acromegaly face, like there's a very specific like facial pattern that happens.
Is this
like
just like puberty too?
Basically, right? Like, so it is the growth hormone that's being secreted that's the same in puberty, but it's happening when they're already like grown adults. And that's like basically creating them to grow inside of, you know, a fixed skeleton. So if you look at like the acromegaly face, so like acromegaly jaw, it is a very like typical pattern that these patients have. What you learn in med school is that you never actually test the growth hormone itself. You look for insulin-like growth factor 1 because the IGF-1 that's actually created by the liver responding to growth factor is actually what causes their symptoms. And you'll see that they'll develop, you know, diabetes because like the growth hormone is constantly burning fat, right? They're constantly like going through puberty in that growing sense, but they're already fully grown.
So the diabetes is connected because the acromegaly causes diabetes?
Yes. So it is specifically the pituitary. There's a gland in your brain that has like a cancer or something or a growth, and it is inappropriately secreting growth hormone. So when you said brain tumor, you were actually kind of on the right track.
Oh my god, that's crazy.
Yeah. So for this, we can use we can treat it with like medical therapy or radiation or like growth hormone inhibition. But I think ultimately like the first line treatment for a macroadenoma like that is just, you know, a transsphenoidal surgery. They just go through your nose and they resect the tumor through your nose. Good job.
Thank you guys. My name is Hazmi, MD. For today, I am your intern doctor here at the Saiken MD clinic. Thank you for having me. I hope I did better than Bree.